Candidate for Member of Parliament Pingire. We are here in Agonyo in Kiretok. We are here for a very critical and important function for our people. The last 5-6 months we've been moving around the constituency. We wanted to understand the real pain points that our people go through. And 3 things come out very clear. And today here we are to demonstrate and give an answer to the 3 critical things that we think our people are suffering from. So one of them is about education. Where we are here, the entire ward, despite the policy of government that says that for every ward or parish there should be a primary school, this ward does not have. So we are here to help complete a school for our people so that we support our parents, we support our children to go through education. The other thing, and it's not just here, we know about 5 schools that have been created or founded by parents, and all of them have been struggling. One of them is Oucor since 1985. Another is Okidi for 27 years. Another is Obangin Primary School, a community primary school for 24 years. So all these are schools that our parents, that our children should go through. So we want to start from here and help government supplement them in completing what we can do as parents, as stakeholders of education. So here we brought iron sheets that will complete a classroom block, and we're also going to support them to increase their land. We are going to support them in terms of the structures, in terms of the administration. And we'll do the same for the other community schools, so that as we love the government to do what the policy says, our children should be going to school. The second thing is about our livelihoods in our families. People are poor. Our people are unable to afford a meal. Even the recent census that we had last year in May, it showed that there is an increment, whereas generally in Uganda, there has been a drop by about 4 people who are within the poverty line. For Pingire constituency, 2 people have been added on the poverty line. And this constituency, being a rural constituency, and purely about 2 activities. One, the fishing community on the lower end of the shores of Lake Victoria, Lake Yoga, and then on the upper side we have farmers. So the poverty, instead of reducing, continues to increase. So we want to start projects. We want to put our people in groups so that we can supplement PDM, we can supplement the skilling of our young people, we can supplement on the Myoga, we can supplement on the youth livelihood program, we can supplement government on their efforts. So one of the things that I've done is to establish a rural bank at Oucor, and the people are already starting to see how it is supporting them. And we are going to go to the villages, put them into groups and support them so that we can help them fight poverty at a family level. The third, which is in the heart of these entire programs, is health. Our people are unable to afford even a book, an exercise book that a health center requires of 300 shillings. This is the major problem, because an healthy population, somebody who is not healthy, is not able to work for themselves, is not able to take their children to school, is not able to support their families. So today here, we are demonstrating that we can again come and supplement government. We are providing free medical health. Free medical, as in the word free, 100%, right from the testing, right, whatever we want here to be able to test all major diseases that are in our community. We want to be able to test the HIV, we want to be able to screen for cancer, we want to be able to test diabetes, we want to be testing hepatitis B, hepatitis A and C, we want to be able to test malaria, we want to be able to test. And here, this is what's happening. And once you finish testing, you now go to where again you go back to the doctor and they interpret what the results from the lab are, and you are treated right from here. And after you've got treatment here, the VHTs, which is a very expansive health program in our village and rooted in a village, we are going to use it. We are going to give 60 bicycles. And here we are going to give bicycles for all our VHTs for the entire sub-county or town council of Kiretok. This is meant to support them. We're also going to give them first aid kits so that every village has a first aid kit, every village has a bicycle for mobilization, every village has a contact that whenever you have a problem, you are able to contact them and they connect you, and we are able to support you. So we are going to move to every village, every trading center, like today here, and make sure we treat our people 100% free. We are going to do the same in the other sub-counties of Pingire and Labor. We are going to move to all the landing sites. We want to support our people because we know that once they are healthy, they will be able to toil and answer the other problems. So that's why we are here, and you can see the numbers that have shown up today on the day one. This is a program that has taken long, that we've been building, and today when they had, the line is long, it is exhausting. And the other thing, we have looked at sustainability. That's why we've brought in board local council. We have brought on board our leaders of the party. At the village level, we have brought on board the VHTs, which is a structure that has existed over years. We have brought on board the health centers of government. And that's why you see here that we have the Dr. Tim, for instance, is the one who is leading this program. Dr. Gwal is part of the program, who is our acting DHO. All those doctors will move to every village to support our people. And all the workers of the health centers, in government, in Pingire, in government, in Labor, even the health center of Kiretok, which is a mission-founded health center, they have to work and support because we want to help our people. And we're also going to support government where they are not able to meet some of the requirements like medicine and so on. I have invested 500 million shilling in this program. That's why you see there's a van here that is able even to put somebody on oxygen. We have a fridge here that has blood. We have all the things because we are doing things that are intentional, that are purpose-driven, that want to help our people. It is not politics, it is about service. And that's why we have brought them here. If somebody right now needs blood, we will be able to support here. If somebody needs oxygen, we'll be able to support here. If the conditions get worse, we will be able to transfer a person to the right medical facility. That is what's happening here, and it's going to go to all villages. So I take care.